And I've gone ahead and started the recording as well, just so you know. All right, I'm going to go ahead and get us started as more folks come in. Grace, if you can just let them in and mute them, that'd be great. But I wanted to go ahead and welcome you all to the Coordinated Human Service Mobility Plan meeting for the Central Region. I'm Jess Maffey. I'm a transit programs manager with the Virginia Department of Rail and Public Transportation. And I'm glad everyone could join us today. First, we're just going to go through, in case you didn't hear it, we are going to be recording this meeting. I'm going to go through some housekeeping real quick. Please remain on mute for the presentation. I will pause at least once for questions. When we get to that point, if you can just raise your hand using the raise hand feature at the top of your screen, we'll call on you, or you can always put questions in the chat. There will also be an interactive portion of this meeting at the end. At that point, I will call on you and you can unmute yourself. And at that point, I see a lot of people have their cameras on, which is great, but I'll also invite you to turn your cameras on when we have that sort of discussion portion. So as I mentioned, this webinar and each regional webinar is being recorded. DRPT will post the recordings on the DRPT YouTube page, and we will also send it out to all registrants. You are also going to receive the slides for this presentation. These slides have a lot of links embedded as well, so that will all be available to you, everything I go through today. And as my 5310 applicants know, this meeting counts toward points on your FY25 application. Since you registered for the webinar, I'll have that list, so I'll have you in there. I know some of you will attend multiple regional meetings, or maybe you'll just attend one. As long as you get one out under your belt, that's really what we're looking for. So if you miss another region, that's okay. You can always just let me know which you're attending. And I also quickly wanted to let you know that I have another DRPT staff member here, Grace, who's going to be doing part of the presentation as well, and she's going to be helping moderate. All right, so today what we're gonna get into is, first we're going to do a quick group introduction just in the chat, and we'll ask you a few questions there, and we'll use that later on for our discussion portion. And then, since I know, a lot of people are old hat at this, some people are new, we just want to go over briefly what is a coordinated human services plan, what are the federal requirements, what's the format. Then I want to go ahead and go through quickly the update, the 2022 update, which is the plan that we just released. And so I'll briefly go over the 2019 plan as well as the most recent update and some ways for how we would like you to use the plan. And then we're going to go into an introduction to the CHSM story map. So that is a new feature this year. It's an online version of the plan that we're hoping will be helpful for you all in this application and beyond. And that's where Grace will join me and help go through how to navigate that and how to find the information you need there. And then finally, at the end, we'll have a roundtable of introductions, and I'll call on each of you just to briefly chime in. I know we've got a bunch of participants here today. Let's see, there's at least 30. So I'm going to try and I might go a little faster through my presentation just so we can get everyone their time at the end. But I did leave that extra 30 minutes at the end of this call to make sure we can get everyone. Okay, so if everyone will please take a moment and in one message in the chat, please put your name, title, the organization you're with, where your organization's located, and your email address. If you don't want to share your contact information, that's fine. Part of the purpose of this meeting is to find opportunities to coordinate and collaborate or give you ideas for that. So the idea is that after this meeting, I'll be sharing that contact information out with everyone, so you all get access to that. So I asked you to just try to put it in one message so that Grace can easily assemble that list together for me for the end. So I'll just give a couple minutes and I'll let you guys put those into the chat for me, please. All right, you guys can keep on putting those in there into the chat, and anyone who's on the call, just submit those. And I'm going to move on for now to just get us going into this presentation portion. Okay, so what is a coordinated human services plan and why do we do it? The Coordinated Human Service Mobility Plan, or CHSM, is a federal requirement as part of the FTA Section 5310 program, and DRPT is the lead agency for developing this plan for most of Virginia. So the requirement for 5310 is that we create a plan that assesses current services throughout the state, as well as transportation needs of seniors, defined as people 65 years of age or older, and people with disabilities. And it also identifies strategies to address service gaps and sets priorities for project implementation to address those gaps. These are high-level statewide strategies. Anytime you have a statewide plan like this, it's pretty high level, and it's not expected for these things to happen tomorrow, but this is kind of the direction setting. So one thing to note is that the urbanized areas of Northern Virginia around Washington, D.C. are included in a plan developed and maintained by the Metropolitan Washington Council of Governments. So MWCOG receives funding to support localities in Northern Virginia. So any locality that COG receives funding for is not eligible for funding through DRPT. And there's a few specific localities that have some funding through both COG and DRPT if their service area crosses both areas, but I think most of you know who you are if you're in those zones. But just to let you know, our CHSM plan does not cover the COGS service area. Okay, getting into the FTA requirements for the plan. So when we go about, DRPT goes about creating the plan, this is what we keep in mind and have to follow. According to federal regulations, the CHSM plan has to include input from the people it covers, which is individuals with disabilities and seniors. That's the eligible population served by the 5310 program. It also has to include input from representatives of public, private, and nonprofit transportation agencies, human service providers, and other members of the public. There's a strong focus in the creation of this plan on coordination and collaboration. The plan should bring together all the stakeholders in an area to ensure that individuals who need transportation are getting it and that services are not being duplicated within an area. This plan follows a federally mandated update schedule with a minor update every 3 years and a major update every 6 years. So we just completed the minor update, the 3-year update, which included updated demographics data, inclusion of new survey results, and some updates to the action tracker strategies based on those results. So the one we're going to go over today is the 2022 plan, which was just released. And then the next update that's going to happen is the 2025 plan. And I just saw, Ken, you're not seeing the slide here. Can you see slide 6, Grace?
I can.
Okay.
It says presenter has turned off participant navigation.
Okay, that should be correct. Tony can't either. All right, can you guys see it now? Or can you move among the slides? Okay, Tony can. Ken, I saw you shaking your head, but I made it so maybe you could move forward to slide 6. No? Okay. Okay, Frank can as well. I'm going to go ahead and click on the next slide. So we're on slide 7 now. Good. All right, great, Ken. Okay, sorry about that. All right, so for the plan format, this has traditionally been and still is one document covering the entire state. And I apologize if you guys could not see my other slides, but thank you for your patience. So the plan format for the entire state has been a PDF document. It provides a summary of statewide demographics, available types of transportation, needs and gaps in human services transportation, and strategies to address those gaps. It also contains regional elements that address the unique challenges, needs, and goals of a single region. So we're in the Central Region meeting, and there are 5 other regions. Those regions, those were formulated as part of the 2019 plan. Previously, we had organized it into many more regions. This one is more of a consolidated regional plan starting in 2019, and we continued with that with the 2022 plan, since again it's just an update to the 2019 plan. And this is meant to demonstrate both statewide challenges as well as regional challenges. The 2022 update, the one we're going to go over today, includes a story map version, which if you've never heard of a story map, we're going to take you all through it, but basically it's an online interactive version of the plan that embeds a lot of data into maps that provide more detail. So we're excited to show you that and demo that today for you. This, where you see this little click button icon, that's places where in the slides you can click on these to take you, this will take you to the PDF document of the plan. Okay, moving on to slide 8, we've got, so this is, I was just going to recap the 2019 plan creation, just for anyone who wasn't here when that was introduced and talked about. So real quickly, so in the 2019 plan, the plan creation, they identified 6 regions for the state, which follow the Department of Medical Assistance Services, or DMAS, regions for Medicaid providers. So this was meant to be kind of familiar regions to many people who work with Medicaid. And you can see the DMAS map is actually at the top. And then you can see the CHSM map is at the bottom. And that's where we have those distinct regions marked out. They follow the exact same lines. And that's how we determined who's in each region. To create the 2019 plan, they conducted a study involving many surveys, interviews, ride-alongs, public meetings that identified statewide needs and gaps in services. It also identified underserved populations beyond the 5310 eligible populations, such as low-income people, veterans, unhoused people, and youth. And it also identified gaps specific to each region and recommended strategies through an action tracker. So that action tracker is what you'll be using for your application, and we're going to get into that in more detail. It also identified major statewide recommendations for coordination across all groups, including the RPT. So that's kind of what came out of the 2019 plan. As we get into the 22 update, it really, again, built off the 2019 plan. We use the same regions. We use the same populations and providers, but we updated demographic information using the most up-to-date information from the census. The new parts of the 2022 plan were including and analyzing rider and provider surveys. I know many of you probably participated that sometime in the last couple of years, but basically we analyzed providers with a VCU group that did that for us. And then they also created a rider survey, which we had going on for a few months online. And this plan brought together all that data and synthesized it, and it's in the plan. So we also, based on that, particularly the rider survey, we added a new category to the action tracker, which we'll talk about. And we also added a public-facing story map version of the plan to DRPT's GIS library. So this is a GIS program. Some of you might be familiar with that. And again, this little click button icon here, that will take you, this is just the homepage to the story map. And Grace will get into this in a little bit, but basically each of those squares is a different chapter. And that's how we organized it in the story map. So it follows the exact same model as the PDF. Okay, this slide I'm going to just take a little time to go through. I want to talk about how we use the plan and then how we recommend you use the plan. So how DRPT uses the plan is we use it to guide our investments in Virginia's transportation services that are designed to meet the needs of the eligible population. This plan is a living document that can be updated on an ongoing basis to account for changes in technology, new transportation challenges, and transportation successes. We expect our grantees to take an active role in implementing projects to advance mobility for all Virginians, and we'll continue to support these projects to the best of our ability. That being said, this plan does not prescribe funding, nor will there be sufficient funding through DRPT's programs to fund every recommendation or every priority or action item. Organizations working to further transportation should continue to explore funding opportunities with other local, state, and federal agencies. How you all should use the plan. So the plan provides many areas of high-level information, but the idea is when you're reviewing it, reading through it, there might be some challenges or opportunities that may stick out to you based on what you know about your region, your partners, or your potential partners. The first bullet there says, I'm on page 10, Barbelane. Sorry, everyone, page or slide 10 if you're not on slide 10. So the first bullet there says that the plan identifies statewide and cross-regional challenges. The plan very clearly demonstrates that a problem in one area is likely a problem in another. There just may be a few different types of obstacles in each region. I want just to give a few examples of statewide challenges that the plan talks about. One statewide challenge is there are long driving distances in rural areas. You know, whether you're in Hampton Roads or Big Stone Gap, in rural areas, you're not going to avoid long distances. You might just have different types of obstacles in your way, whether it's tidal flooding on the coast or snow in the mountains. Another statewide challenge is that public transportation doesn't always cross locality lines. There's several examples out there of residents getting off of the end of a transit route line and having to walk to a facility because it just doesn't take them all the way. I know there's one example of a cross-agency collaboration between WADA and Hampton Roads Transit, where they actually formed a cooperation and used a federal grant to connect two bus lines on a project just like that. That was to reach a clinic. This wasn't a 5310 project, but it's just an example of the kind of collaboration and coordination we're talking about, where two groups came together to solve a problem. Another statewide challenge is that the cost of transportation can be prohibitive for some individuals, as many of you well know, particularly for those who need more than one trip every now and then. So a low-income individual who doesn't own a car but needs to get to work every day, or someone who needs dialysis 3 times a week and lives in a rural area. Those are, costly ways to get transportation. So I know a lot of these challenges probably sound very familiar, and the CHSM plan has many more examples. The plan is also meant to provide ideas for how agencies can seek out different sources of funding and or collaborate with other groups to provide service. Some examples of these opportunities could be exploring additional federal opportunities for funding. So this could be other FTA programs that DRPT, a provider, or even a planning district commission applies for and that you become a partner on. Or it could be transportation funding through another agency that can be coordinated. So looking for those opportunities to, work with other groups that maybe have other grants already going on that you can come in on to solve these transportation problems. Another one is coordinating funding across state and federal programs, which could mean something different depending on the agency. For example, community services boards receive general funds through the Department of Behavioral Health and Developmental Services, and some of those use funds for transportation. So there could be opportunities for DRPT to work with DBHDS or other state programs to consolidate funding for transportation. And that's something that we look at as well. But are always open to talking to you all about if that's the kind of funding that you're using for transportation. Another thing we talk about is, and I know has become more and more of a topic, is the use of transportation network companies or TNCs. So I know in addition to, we know Uber or Lyft, there's groups like Userve, and we know that GRTC has used Userve to augment its paratransit service. And that kind of provides a different sort of service that can still meet FTA's requirements for public transit providers. So, DRPT is interested in groups looking into solutions like that or trying to see if those could work for them wherever they are. All that being said, next, the plan is also meant to guide you in understanding what DRPT is interested in funding. As I kind of mentioned previously, it doesn't prescribe what we fund, as in the projects or the action items that we suggest. If your projects don't perfectly align with our goals, it doesn't mean you're ineligible or your plan is going to be rejected. But it does give you a better idea of what we're looking for and what we've identified as important in each region. Plus, when you do apply and fill out a 5310 application, you will have to fill out a couple of questions about the plan, including which action tracker items that your project ties to. So we do expect you to reference the plan, review it, and that's part of the purpose of the meeting today, is to get you introduced to it. Finally, part of this plan is this meeting. We asked that everyone in a region meets once per year. And what we hope is that everyone can come together, be introduced. Some of you know each other, some of you may not, but at least put some names and faces to potential partners. It's not the only way we want you to collaborate, but we hope that, at least by bringing you together once a year, and sharing your information with each other, you can use that as a potential jumping off point. Okay, I'd like to go ahead and get into the story map. If Grace, you want to take over, I'll let her introduce it.
Okay, I'm going to share my screen. Okay, can you see it?
Yes.
Okay. So I know Jess sent a link to the story map, and of course you can click on it here once these slides are made available, but I'm just going to go over another way that you can access the plan. And so if you go onto DRPT's website, drpt.virginia.gov, and you go to our grant programs here, the third drop down, can you see my screen still?
Yes, I can.
Okay, sorry, the thing just kind of like, it looked like it was
It's okay.
freezing. Okay, and you go to Human Services Grant Programs and click there. Okay. Here we are. And this is all the information you'll need for your applications, for your grant management. But if you go to the bottom for application resources, you will see the PDF version of the plan. And then this third link is the link for the story map version. So I'm going to click there. And this is kind of the home page for it. Like Jess mentioned, everything is laid out in the same order as the PDF version. This is just sort of like a different way to look at it. And there's some advantages to having the plan in this sort of format. And so if I go to the statewide profile, this is a chapter in the plan, but it's also a chapter in the story map version. We have like a write-up on the different demographics throughout the state. And it takes a bit to load sometimes because there's a lot of data in here. But so there, we have a write-up of the senior population throughout the state of Virginia, and this is sort of interactive in a way that a PDF cannot be, because if you click on one of these, you can see population data for each individual county, and this is scalable. So if you zoom in, you can, and again, it takes a bit, you can drill into the census tract level. And so you can get that information for individual census tracts along with individual counties. Again, it's moving a little slowly right now. There's a lot of information. And so we have this for the senior population, population with a disability. And if we go down, we have other characteristics that impact mobility. So they might not be necessarily 5310 eligible, but they're, important to consider. And so we've included them in the plan. And so if you click on this button, you'll be able to see the population in poverty. The scaling works the same with these. We have zero-car households, a vulnerable populations index, which was determined based on a previous DRPT study. And then we have other demographics. So you can just toggle these on and off just to see what you're interested in, and zoom in and click around to get a better idea of the populations in your area. And so just for general navigation, if you want to go back to the home screen, you will just click this top button here on the left to go back. And then I will go to the action tracker. Jess is going to cover this in more detail, but obviously there are she lists the individual gaps that came up in this latest round of outreach. And so there's little descriptions about each of them. But then if you click on action tracker here, this will bring you to an interactive version of the action tracker. And again, this is the same information that's in the table in the PDF plan, but this is just a little bit more interactive. So you can select by transportation gap to only see the actions for that particular gap. Or you can select by individual goals. So you want to improve the rider experience. You can select that and see what the different actions are for that. And there's different ways that you can kind of like slice and dice these action trackers to use on your application. And then one final thing to touch on that I think will probably come in handy the most for your applications is these regional profiles. And so we came up with one for each region, and they look a little similar to the statewide profile. They have, like a write-up about the general region, demographics, and then regional issues and the high priority action items. And so you can view the transit service in this particular region. And so this, I think, will help with coordination, just to be able to see who's operating in each region for more collaboration. And then similarly to the statewide profile, we have the senior population just for the individual region, if it decides to load. Okay, yes. And then population with a disability, we have these, and then again, additional demographics that you can click on and off depending on what you are interested in the particular region. And then from the PDF, we have the table of regional issues that pulls gaps from the 2019 plan, and then new gaps that might have come up from the 2022 plan to tie into the action tracker. And then finally, we have high priority action items, which each region we've kind of pulled out based on the outreach, just high priority items that, hopefully are addressed in some plans. And this is sort of meant to be a guide as you work on your applications. And then finally, you can just go back to the action tracker as a final viewer. Let me know if you have any questions. That was a lot of information.
Yeah, we can pause here if anyone has any questions about the navigation, or if you want Grace to look through anything on the navigation again for you. I'll get into a little more of the content, but let us know if you want us to click through anything here.
Okay, with that, I'm going to stop sharing, Jess.
Okay. Alrighty. I'm going to go ahead and now share my screen. Alrighty, so just kind of leaving off or picking up where Grace left off. I want to go back into the action tracker and just go through that in a little more detail with you all, because this is really, this will give you a full picture of the gaps and goals for the entire state. As you saw with Grace, if you go into your individual region, you'll see the priority action items for each region on that list. But ultimately, your project should align with any of these goals or action items, not necessarily just the ones identified in your region. We want to provide that priority for the region, but ultimately, at the end of the day, when you're applying, this is the list you're going to want to come to be able to relate it to your project and think about what your project needs to address. So I'm going to go ahead and read through each one, which should hopefully give you a pretty good idea of how we're thinking about these gaps. However, as Grace mentioned, you can go through and actually read this chapter to get a more in-depth definition of what we're talking about here. So I'm gonna pop this open real quick, because this you can also expand this to fill the screen. Okay, so looking at the action tracker, we've got the first gap is trip availability. We identified the goal as just expanding service availability. So those action items that could be expanding after hours transportation, increasing the availability of long distance trips, or expanding trip types to better meet rider needs. On the next gap here, we've got trip accessibility. So just, pretty basic, but improving access to human service transportation. That means providing transportation to seniors or people with disabilities who can't use public transportation or who live in an area where it's not available. This also could include enhancing scheduling, making that easier for people to use or get to. And it also could include exploring the feasibility of expanded door-to-door service. So again, just that access point. Trip reliability. This is actually the new item that, or gap item that we mentioned, and I wanted to pause here just to explain this a little bit more. So when analyzing the survey results from riders, we were finding that the idea of rider experience kept coming up a lot. And it seemed to overlap with other categories, but also kind of have its own nuance. Riders were using the word reliability a lot, as well as things like cleanliness, friendliness, or talking about their experiences using technology to schedule rides, whether it was easy for them to use it or really difficult for them to use it. So right now, some of the action items under this category are pretty much the same as other categories, but the idea is that, and again, you can reference more than one action item on your application. It could be it's kind of exactly the same, but the idea is that by indicating you're working on this action, one of these action items under reliability, is that you're kind of looking at improving rider experience overall, and you think your project will do that. So again, the goal would be improving the rider experience. That could come from implementing standardized education and training opportunities for your operators, making sure they have proper training and resources to manage and provide aid to the clients. It could be increasing staffing so that operators can better meet passengers' scheduling needs, or get there on time, or whatever the case may be. It could also include exploring implementing improved public-facing technologies such as software or apps that is made to be user-friendly. That might be good for some groups and not for others. Again, these are not prescriptive. It's just what you want your project to focus on. Under the transportation gap service alternatives, we have the goal of expanding transportation options. So this could include partnering with public transportation providers to determine opportunities for efficiencies with route modification, deviated fixed route, basically just that collaboration we're talking about, if there's an opportunity there. It could include partnering with hospitals, medical centers, or other healthcare facilities to determine how transportation services could assist their clientele. It could be partnering with educational facilities for their students with disabilities. Or it could be continuing discussions or starting discussions with TNCs to determine their role with human services transportation. This is a kind of, an ongoing conversation we're having. Under the gap of coordination, this is, a more general or wide-ranging thing, but under this, the goal would be increasing statewide and regional coordination. So this could be working with your local jurisdiction to include human services transportation into location transportation planning. So kind of advocating for human services transportation in your locality. It could be developing and maintaining statewide and regional advisory committees to focus on coordination of service providers. Now, this is really one that was sort of identified for DRPT, and it's something that came out of the 2019 plan, but sort of lapsed during COVID. So that's something that we're also looking at internally on what would be the best path there and what would be the outcome of a group like that. It could also be continuing communications with organizations that are involved with and support transportation. I know a lot of you are very familiar with CTAV. It could be, or VAM. There's a lot of different groups throughout the state that meet and coordinate, so it could be participating in that. Under education and training, we have actually more than one goal here. The first goal is just increasing awareness of available service. So this is the outward facing goal of getting out to your public, your riders, if you're a client-based center, making sure that people who are coming into your facility know that transportation is one of the available services if they're with you. It could also be, the next one would be providing education and training for staff and riders. So that's kind of the more internal education and training. So that again could be that expanded education opportunities for your operators. It could be standardizing your education and training, particularly using national recognized training courses like PASS. I know many people have used that. Or it could be, providing travel training for your riders. Again, it's kind of what works for you, what would be a focus for your organization or your needs. And finally, under the gap of funding, something we all, want is increasing sustainable funding streams. So looking into increasing funding for labor costs to recruit and retain operators and staff. We all know, staffing is an issue and continues to be, and many people are looking at solutions for that. Exploring and applying to alternative funding sources beyond 5310. That's something we always encourage as part of this program, but really looking into what's offered in your community or your locality. And continuing to work with local and regional government officials to increase available funds for capital purchases, maintenance costs. Really, again, that's more, in my mind, kind of an advocacy piece. How can you get out in front of your local government to see how human services fits in? Okay, so with that, again, this is really, I just wanted to go through everything here because, in your region, the central region, some of these as you saw on the regional profile, will be indicated as the priority. But really, this is, if you look at anything in the CHSM plan, please be sure to look at the action tracker. That's really where you want to go when you're working on your application to find kind of where your project fits in. And with that, I'm going to go ahead and go back to my presentation. So just give me one moment to bring that up. I guess in the meantime, does anyone have any questions now for me before we go into our discussion portion?
Jess, hey,
Yes.
This is Tony.
Hi, Tony.
So just to sum all this up,
Sure.
When I write my application next year, in the narrative section, I just need to be sure that I kind of go into detail which of these action, all of our action items that are performance metrics, they just need to be like elucidated in the narrative section. Is that correct? I mean, they should kind of mirror or expound and show how it ties into the how each individual program adheres to or is addressing the items in the CHSM plan. Is that pretty much a decent summation of how we're supposed to use this? In other words, it's just a guide.
Yes.
But you do want these things in the narrative section, and you do want them to have some detail and some context, correct?
I would say so. So there will be a section, there is a section, I should say, of the application that asks you explicitly to talk about how your project ties in to the action items. So it really, I mean, it really is not
different, right? I mean,
yeah.
Okay. So, well, then that pretty much answers my question.
Okay.
Because in other words, if you all don't take care of putting it somewhere in the application, we would just need to be sure that we put it in the narrative section, but it sounds like you're fleshing it out a little further to standardize it more. Is that?
Yeah. There'll be a question about explicitly at how your project ties in to the CHSM plan and where you can identify which of those individual action items you're relating it to.
Great. That actually makes it sound easier to organize our thinking as we look forward to the next grant period. Well, thanks, Jess, for answering my question.
Yeah, of course. And I'll also just say, I kind of touched on this a little bit, but it's not it's not about how many action items you relate to. It's really the idea is that, I mean, definitely tied into at least one. And just, I think almost everyone, I hope, can relate to at least one of those action items with their project and just be able to explain, how this project advances that action item. And that's really what we're looking for. Cool. Okay, so I want to go ahead and invite everyone. I know a lot of people already have their cameras on. If you'd like to turn your camera on, go ahead. But we're going to go ahead and go through a roundtable of introductions. And what I'm going to do is I'm actually going to call on each group. And Grace is providing me a list of all of you that put yourselves in the chat. If you did not put yourselves in the chat, go ahead and throw your name and organization in there now. If you came in late, if you want to just throw those in there, we'll try to get to everyone. If I miss anyone at the end, just call out and we'll get to you. But we really do want everyone on the call to introduce themselves in one way or the other. I'm going to call on the groups that I know first who have traditionally applied to 5310. So those are going to be the first group, and I'm going to ask you to introduce yourself briefly and your agency, what you're planning on applying for, and just talk a little, very briefly about your proposed project. And then everyone else or anyone that I don't know whether you're applying to 5310, I'll call you out individually as well, and you can just introduce yourself and let us know. So let me go ahead and pull this up. All right. Thank you for the list. Okay. So if we could have Tony, Capital Area Agency on Aging, if you want to kick us off here.
Okay. Well, thanks. My name is Tony Williams, and I'm the mobility manager at Senior Connections, the Capital Area Agency on Aging. Our program operates in Planning District 15, which is Richmond, Ashland, and the surrounding 7 counties. Our program is pretty much based on addressing the needs elucidated in the CHSM plan. We've been receiving DRPT funds each grant year since 2011. And we are, Senior Connections is the designated human services transportation coordination entity. So by a very definition, we foster partnerships in the region with regard to transportation. And I believe my supervisor, Missy Boyer, is also on the call too. We wanted to be sure that we were both here for that.
Awesome.
Thanks.
Thank you both. Thanks for coming. All right. Next we have GRTC, Kelsey or Tim. If you'd like to introduce yourselves, one of you.
Hi, Jess. Hi, everyone. I'm Kelsey Calder. I am with GRTC, so that's, the public transit service in Richmond, and I am the travel training instructor. So what we will be applying for will be under other capital and mobility management for our travel training program, which will be my salary and then any other marketing materials that we would like to make for the year. And so we have been applying for 5310 since I've been on board, which this month makes 8 years. So we really appreciate the 5310 grant funding and look forward to all of the other partnerships. Thank you.
Great. Thank you, Kelsey. Next we have VPAS. I know Valley Program for Aging Services, Janice. I know this was your unplanned group to join, but go ahead and introduce yourself.
Yeah, hi there. I'm Janice Gentry. I'm with Valley Program for Aging Services, and we serve Planning District 6, which is Rockingham, Augusta, Rockbridge, Bath, and Highland County. So we actually are in the Western and Allegheny regions, but schedules had me attending this regional meeting instead. And we are going to be applying for a new modified minivan to serve in the Harrisonburg-Rockingham area, and also operational funding for our senior transportation program, which is a combination of paid and volunteer drivers, where we match requests from seniors who don't have the ability to navigate our public transportation in this area, or there isn't public transportation available to go where they need to go. The majority of our rides are to medical appointments, either nearby where the person lives or outside the area, as long as we have a driver available to get them there.
Great. Thank you so much, Janice, for joining. St. Joseph's Villa, Karen Hansen, if you'd like to introduce yourself.
Hi, Jess. Thank you, everyone. My name is Karen Hansen, and I'm the Director of Grants at St. Joseph Villa. I've been here for about a year, but this is going to be my first time trying to get my arms around these grants and potentially applying. I don't even know yet for sure if we will, but we are a nonprofit in the north side of Richmond, and we serve actually about 30 localities in this central region here, mostly with educational programs for children with learning challenges and disadvantages. So we have received grants in the past for vans to transport our children. We also have housing and homeless services and mental and behavioral health services. But yeah, again, I'm not quite sure yet where we're going, but I'm trying to get to know all of you and get an understanding of the program and see if we're going to apply for another van. So thank
Great.
you.
Yeah, thanks, Karen. I appreciate you coming. Hanover Dash, Debbie.
Hello, everyone. I'm Debbie Preston. I'm the Director of Community Resources for Hanover County. We also, within our department, have Hanover Dash Specialized Transportation Program, and we do have Susan Richards on the call, the Dash Manager. I have the privilege of writing the 5310 grant for the last 2 years, so this will be my 3rd year writing the grant in conjunction with Susan. We apply for part of Susan's salary and operations and also some marketing materials, and we're excited to see this program grow. It's we're going to be celebrating our 3rd full year in December, and of course we started when COVID hit. So I don't know if we should really count that year or not, but it was still successful. So thank you for having me, Jess, and Susan's on the call too.
Great. Thanks, Susan and Debbie for joining. Powhatan Department of Social Services, Jane.
Hi, I'm Jane Lloyd, and I oversee Ride Assist Services, which is a volunteer transportation program for seniors and individuals with disabilities, and we are going to be applying for FY25 for operating, and yeah, I have great volunteers, so good to be here.
Always great. All right, the Chesterfield County Mobility Coordinator, Frank Vance. I think you're muted.
Hi, I'm Frank Vance, and we're applying for 2025. In addition to wheelchair transportation, we've recently acquired the ability of tracking senior trips. So we're going to apply for that, and also continued with one of my coworkers who is funded through the grant. So we're going to try to continue that. That's where we're at. Great.
Thanks, Frank. Next, I've got Heart Havens, Sarah Becker.
Hello, I'm Sarah Becker. I'm the Development and Maintenance Coordinator for Heart Havens, and we have 8 group homes around Virginia that serve adults with developmental disabilities. 4 of our homes are in the Richmond area, and we are planning on applying for a replacement vehicle at one of the Richmond area homes.
Great, thanks, Sarah. Lake County Area Agency on Aging. I see there's a few of you on here. Whoever would like to take a stab at your introduction. See, Marveline, Charlie, or Brielle. You might have to unmute yourself. All right. I'll leave that one for now. Maybe come back. Chesterfield Community Services Board, Phil, if you're here.
Yes, good afternoon. I work in the supported employment program that's operated by the Community Services Board. We work together with other program areas, including our residential services, the day support program, the clubhouse program for people with serious mental illness, to all provide transportation in the community. I believe this year we will be requesting 2 additional body on chassis vans to do more wheelchair transport, and doing some assessment of what we currently have with DRPT and other vehicles in our fleet. One of the things we've noticed, and I don't know if you've noticed this from anybody else, but as a trend, some of our individuals with disabilities really did lose quite a bit of physical capability in that year and a half they were cooped up in their group homes. And so we do have more people that are requiring wheelchair transport that in years past, as I've known people over the years, were, very mobile and up and working jobs and that sort of thing. And they're now in wheelchairs. So we need to kind of increase our capacity there. So that's what we'll be asking for.
Okay, great. Thanks for sharing that. Next we have Capital Area Partnership Uplifting People, Cap Up. It looks like we've got a couple people on, Melanie or Christelle. If you'd like to introduce yourselves.
Hi, everyone. I'm Christelle Brown. I currently serve as the Director of Program Operations and Vice President here at CapUp. I am fairly new to my position, so I am still kind of, getting the reins of how we use our 5310 funding. As of right now, I am pretty familiar with the ways we're using it in Richmond, Dinwiddie, and Powhatan. I know we work very closely with Senior Connections in hosting the senior cafes. And we also do use our 5310 funding for transport of our youth for our summer enrichment program. So I imagine a lot of what we would be seeking is to keep those programs going in the coming years.
All right. Thanks, Christelle. Appreciate it.
Absolutely.
All right. Next, we've got Healthy Generations Area Agency on Aging, Jennifer.
Hi, everybody. I'm Jennifer Faulkner. I'm the Director of Mobility Services here at Healthy Generations. This year will be my 5th year applying for a 5310 grant. Healthy Generations has had a 5310 program for almost 13 years, I believe. And we are again going to apply for mobility management that funds a part of my salary, and also our transit travel trainer that we employ that works with Fredericksburg Regional Transit. We will be applying for operations funding that does support our one call, one click center and our shared ride services that we provide. And I believe we are going to be applying for one body on chassis vehicle. I'm not sure if it's a replacement or an expansion vehicle at this point, but that is the plan for this year.
All right. Great. Thanks, Jennifer. Next, we've got Piedmont Senior Resources, Jordan.
Hey, Jess. Hey, good afternoon, everybody. I'm Jordan Miles with Piedmont Senior Resources. I'm Director of Nutrition and Transportation. We're going to be, with regards to 5310, we've been receiving 5310 money since roughly 2018. The grant has been able to allow us to grow our fleet quite a bit in our non-emergency medical transportation program for older adults, as this is an area agency on aging nonprofit. We're going to be applying for the for the upcoming 2015 grant for capital, which of course is vehicle for one vehicle, and then but mostly operating funds. And we have a voucher program that helps offset the costs based on a sliding scale, based on people's ability to pay with access to transportation. It's good to see everyone.
Great. Thanks, Jordan. And next we've got Mr. Clark Thomas from Rappahannock Area CSB. Oh, yeah, unmute yourself again.
How about that? All right, there we go. Clark Thomas, Rappahannock Area CSB. We will be applying for 5310 9-passenger transit vans to replace a couple of our very older ones. We operate in Fredericksburg, Stafford, Spotsylvania, Carolina, and King George counties, providing day support services, residential services, and our Kenmore Club Cycle Social Rehab Center. And all of those require the vehicles, a pretty good sized fleet, to get our individuals out into the community, take them shopping, doctor's appointments, etc. So again, we'll be applying for 9-passenger vans for them. Thank you.
All right. Thank you, Clark. Okay, so the next ones I'm going to call out also individually. These are ones that I wasn't sure if you're applying to 5310. You can indicate that, or just if you're not, just let us know and introduce yourself, and let us know if you have any connections here you'd like to call out. So the first one I'm going to call on is Crater PDC, Kit and Ron.
I'm still on board. This is Ron Swikowski. I'm the Director of Transportation for the Tri-Cities Area MPO and the Crater PDC. We've had very few applications come through us through this program, which is kind of disappointing because looking at the needs and these maps you all have, we have a lot of needs, but we don't seem to have the providers applying under this program. We just had a Crater District Area-wide Agency on Aging is about all we've had the past few years. So I'm hoping we have more, or maybe some of them are online within the Crater PDC area.
Okay, great. That's good to know. I might connect with you outside of this. Okay, next we got the VRT, Virginia Regional Transit. Michael, or Bruce, if you'd like to introduce yourselves.
Yeah, it's 2 for 1, Jess.
Thank you. Yes,
Bruce to my left, and I'm sitting up close and personal. He made me sit up close and personal. I'm Mike Soha. I'm the transit manager here in the Central Region, our jurisdiction from Fauquier County all the way through Warrenton, through Culpeper, all the way down to Goresville, including Front Royal and Warren. And, we're 5311 provider here, but we're here just listening in on how we can continue our partnerships throughout all the regions that we actually serve. We're really tickled about the travel trainer position. That's one that really comes to light for us, not only for the elderly, but also for the bilingual as well. So we're taking a hard look at that. But we just want to be a good listener, and kudos to everybody for a great job, what you're doing.
Great, thanks so much, Mike. And like I said, I'm going to be sending out everyone's information here after this. So if anyone wants to reach out to each other, you're more than welcome to do so. The next one I'm going to call on is the Northern Neck Planning District Commission. Lisa.
Good afternoon, everyone. We're a commuter assistance program grant recipient, but it's very interesting, and I really enjoyed the story map presentation. There's a lot of great information in there that we can use for our CAP. And we work very closely. We're one of those disabled elderly populations, both also in poverty. And so we rely heavily on Bay Transit for a lot of our work, and I work very closely with them and everything, and try to support all of what they do as well. Thank you.
Great, thank you, Lisa, for coming. Next, I've got Plan RVA, Ken.
Yes, good afternoon. Thank you very much. Ken Lance with Plan RVA. We are not applying for Section 5310 funds, but we are here to help facilitate discussions and planning for coordination among any of the agencies and organizations that are applying. So we wish all of them luck, and if there are ways that we can help facilitate some of that coordination, we'd be glad to do so.
Great, thank you so much, Ken. Appreciate your willingness to help out too. And I think the last one I have is Fredericksburg Regional Transit. Sharon, you're still here?
Good afternoon. My name is Sharon Sullivan. I am the Grants and Budget Specialist with Fredericksburg Regional Transit. We do work with Healthy Generations Area Agency on Aging with their travel training program. They also participate on our Public Transit Advisory Board. They attend the meetings throughout the year, but their program has been phenomenal. They've been helping with getting our with our riders, getting comfortable riding our buses, and the partnership that we share with them has been a great experience, and we wholeheartedly support them. So I just want to say hello.
Thanks, Sharon. I appreciate you coming on and sharing that. Another call for Lake County, if anyone's on here from Lake County. If not,
I think we missed a few that weren't on the list.
Okay. Who else have we got?
Steps.
Oh, Steps. Sorry.
Katie Rhodes.
Hi, I'm Katie Rhodes with Steps Inc. in Farmville. We're the Community Action Agency. We are not doing the 5310 this year, just because we're trying to come up with some new plans on how to. We figured it may be better to come up with a plan before we start applying for money. So we're evaluating our plans and things like that. But we transport persons with disabilities to their various jobs. But we've been applying for the 5310 since 2018, so we've got new vehicles, so we're happy about that.
Good, good. Yeah, I know it took a while, but we're trying. Who else did I miss, Grace?
SOAR 365 was not on the list.
Okay.
Hi, I'm Nita Starr, representing SOAR 365. We have been getting funding from 5310 for many years, and COVID hit, and it kind of took some of the steam out of our sails, but we're getting back to pre-COVID levels now. We support people with disabilities of all ages, and one of the programs that has really expanded greatly within the past year is our supported employment program. It looks like we may double individuals that we help with employment from 80 to about 150 next year. So that means we're going to need to request for modified minivans with ramps, 5-passenger vans, so we can get these individuals back and forth to their workplaces.
Great, thank you, Anita.
Then the final one I had on my list was Colonial Heights Senior Center. Elaine?
Yes, hi, my name is Elaine, and I am the Colonial Heights Senior Center Director. I run the operations. Stacy Moneymaker, who is a transportation coordinator, was unable to make the call, so I'm on here for her. So we offer transportation to Colonial Heights residents 60 and older, or those with disability. And in the past, we've gotten our funding through Crater District Area Agency on Aging. So now we are working towards doing it ourselves and getting out from under their umbrella. So we're hoping to get a van.
Great. So I think that's everyone who's on our list, but is there anyone else here that we did not call on who would like to introduce themselves? All right. Well, I really appreciate you all participating and introducing yourselves. And that's going to be basically the conclusion of this meeting, but I want to give you some upcoming information. The next steps are for the FY25 application. I'll be hosting a pre-application workshop on November 1st. I've sent out some links about that, but some more registration emails will come out about that through our main DRPT email system. Thanks, Jordan. And that will also be recorded. So if you can't make that day, we'll send out the recording as well. And then the FY25 application itself opens on December 1st and closes February 1st. And that will be done through our new web grants system. So we're using web grants as the online application system for this fiscal year application. That means it will not be in Olga, it will be in web grants. And we are going to be hosting some training. Actually, an email went out today about signing up for a registration training. So to get yourself signed up into web grants, that will be at the end of this month. If anyone is not getting the main DRPT emails, please let me know. I can have you easily added to our system-wide email lists. Finally, again, as I said a few times here, if you heard something on this meeting, or if you want to connect with anyone, I am going to send a follow-up email with the recording of this presentation, the slides, as well as everyone's information that they shared in the chat, as well as anything we gathered from outside the chat, just who's here. And I'll be sending that out to you all as well. Finally, if you have any questions, you're always welcome to email or call me. That's my contact information, and we can schedule a call. And finally, I just wanted to provide a little information. This National Aging and Disability Transportation Center has really great photos that I use in this presentation, stock imagery, and that will be available in these slides. All that being said, if anyone has any questions and wants to stay on, you're welcome to, but I want to thank you all for attending today and participating, and you're welcome to head out. So thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Hi, Jess. This is Phil Nussbaum with Chesterfield.
Hey, yes.
While I have an opportunity, I was just curious about something. A few years back, I believe in 18, we applied for grant monies to get software to manage our transportation system.
Okay.
And those